Hi there, you're welcome to Myorisan Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube. Also, you'll be able to support us here on our YouTube channel by hitting that like and subscribe button. And also, as a gift for you for subscribing to our channel, you can hit the link down below in order to download a free healthy meal recipe that we do have here on Myorisan Care. Thank you and bye-bye. All right, so what is our medication of choice? Our medication of choice today is known as Isotretinoin. So Isotretinoin is also known as brand name Absorica, Claravis, as well as Myorisan. So what is this medication used for? The medication is used for acne, or what is also known as pimple. And this medication is not just given for any type of acne. It's given for a specific type of acne known as nodulocystic acne. So usually with patients that have this type of acne, the medication is dosed based on their weight. So usually patients will start on about 0.5 to 1 milligram per kilogram daily, and that is usually divided into two different doses, and it can be taken with or without meals for about 15 to 20 weeks. So like I said, this is 0.5 to about 1 milligram per kilogram. So let's say the patient is 50 kilograms and the doctor wants to place the patient on a 1 milligram per kilogram, then the patient will be taking 50 milligram in two divided doses, which would be 25 milligram twice a day. And like I said, this can be taken with or without meals. And that was just an example of a patient who's 50 kilograms. This doesn't apply for everyone. Also, in terms of patients who have a severe scarring type of acne, this medication can also be increased to about 2 milligram per kilogram per day. And like I said, in two divided doses, and patients are usually taking it twice a day. All right, so what are some side effects when it comes to this medication? So side effects include dry skin. This medication can cause dryness in your face area, so you want to make sure that you're applying the right moisturizer. Also, this medication can cause rash, maybe due to like an irritation on your skin. Also, a common side effect of this medication is joint pain as well as back pain. Patient may also notice some nosebleeds due to probably the dryness effect. Also, headache is common, as well as dizziness, hearing loss, as well as swollen lips. So when it comes to that, swollen lips is also known as cheilitis. You definitely want to make sure that you're reporting these side effects to your doctor when they become bothersome. Okay, so what are some serious side effects that you definitely want to report to your doctor immediately when you start feeling those side effects? So this include signs of depression. If you're having any suicidal thoughts, then you definitely want to make sure that you're reaching out to your doctor to make sure this is not as a result of the medication, or if they would need to add on any antidepressant in the meantime while you're taking the medication to help with that mood changes or low mood effect. All right. Also, in terms of patients, if you start noticing any signs of liver problems, maybe like a dark urine, if you start feeling tired more often, if you start having loss of appetite as well as upset stomach, or stomach pain, some light colored stools, or if you start throwing up, or you start noticing any yellow skin or eyes, then you definitely want to reach out to your doctor to make sure that there is no liver issues coming up in terms of you taking this medication. And that way they can fully assess your liver function to make sure that everything is right when it comes to you taking this medication. Also, if you start noticing any esophagus problems, maybe like your throat problems, if you start noticing any chest pain, trouble swallowing, any new or worsened heartburn, then you definitely want to reach out to your doctor regarding that as well. Also, in patients who have diabetes, if you start noticing consistent increase in symptoms of high blood sugar, like confusion, feeling sleepy, more thirsty, maybe you're feeling more hungry, maybe you're passing out urine more often than normal, feeling flushed, fast breathing or fruity breath, then you definitely want to reach out to your doctor regarding that as well. Also, in terms of this medication, if you start noticing a serious side effect such as eye pain or muscle pain or weakness, make sure that you're reporting to your doctor as well regarding these serious side effects. All right, what should you actually know when it comes to this medication? So when taking this medication, you want to swallow the whole tablet. You don't want to break, chew, or crush the tablet. That way you're not disrupting how this medication is supposed to digest in your stomach or absorbed into the blood, where it's actually going to go to the areas where it needs to work. Also, you want to make sure that you're taking with a full glass of water, and also you want to make sure that you're taking this medication as prescribed. Even if you feel well, this is a medication that you want to be consistent with while you're taking, in order to get consistent results while taking this medication. Also, with this medication, in order to gain the most benefit, you don't want to miss any doses, as I said. And also, you don't want to double your dose just because you missed one dose, or you didn't take it the last time you were supposed to take it. So you want to make sure that you're taking it as prescribed. If it's closer to the day, if it's closer to the time of your next dose, you don't want to take 2 tablets rather than just 1 tablet at that time. Also, with this medication, usually it's given or it's dispensed as a 1-month supply when this medication is picked up. So it comes in a box, and usually patients will have to go through a training session, which is known as the I Pledge. So which is basically you pledging and you getting more information regarding how to take the medication properly, because of the risk that comes with this medication when it comes to reproduction. Also, when it comes to taking this medication, you want to make sure that you're storing it at room temperature. You want to make sure that you're protecting it from light as well, making sure you're storing it in a cool room temperature area. Also, when it comes to this medication, you have to be patient with it, because your skin may look worsened before it actually looks better. So some patient may notice like their skin is peeling. Like I said, a common side effect is also dryness of the face. So you may actually feel like, oh wow, like this is worsening my skin, but in actuality, it just really takes time for that skin to be replenished and go back to how it used to be. Also, when it comes to this medication, you want to make sure you've taken it a couple of times and really understand the side effect that you get from this medication before taking it, right before using any machinery that requires for you to be mentally alert. You don't want to be, you don't want the first day you start taking this medication, you're driving and you're yet to understand how well this medication works for you. Some patients might get dizziness just from taking a medication that their body is foreign to. So these are things that you want to make sure that you take note before taking that medication, right before doing any task, as I said, that requires for you to be mentally alert. Also, with this medication, you don't want to donate blood while taking this medication up until about 1 month after stopping the medication. So it is not recommended for you to donate blood during the time that you're taking this medication, and you want to wait after more than a month after stopping the medication before you do that. Also, you want to make sure that you are getting your blood work done to make sure that this medication is working as it's supposed to, making sure that you're keeping your doctor's appointment. That way they're checking to make sure that this medication is working effectively and properly as it should. Also, with this medication, you definitely want to apply sunscreen if you live in an area where there's high sun exposure, because this medication can actually increase your skin sensitivity to the sun and cause for you to be sunburned more easily. So you want to make sure that you're avoiding sun or sun lamps, tanning beds, making sure that you're wearing appropriate clothing or using sunscreen or eyewear to kind of protect your face or your skin from the sun while you're on this medication. Also, if you do have diabetes, make sure you're talking to your doctor, as this medication can actually increase or raise your blood sugar. So make sure that you're talking with your doctor to make sure that they're giving you the appropriate dose, and also they're letting you know what to look out for while taking this medication. Also, in terms of this medication, it can actually affect growth in children or teenagers in some cases. So these are side effects that you want to discuss with your doctor before starting this medication. That way you can kind of weigh the risk and benefit of starting this medication, and you're aware of, you know, all that you need to know in order for this medication to be effective and safe while you're taking this medication. Also, when you're taking this medication, you want to avoid any cosmetic skin treatment like waxing or dermabrasion or laser treatment, as this can also increase your irritation of your skin to these treatments. So you want to wait for at least 6 months after taking this medication or after this medication has ended before you start subjecting your body to this kind of skin treatment. Also, when you do that, when you do the, you know, the skin waxing, the dermabrasion or laser treatment while you're taking this medication, it can actually increase the risk for your skin actually scarring while you're taking this medication. So you want to make sure, like I said, you're avoiding that for about 6 months or more after stopping this medication. Also, with this medication, usually you have to take 2 pregnancy tests that shows that you're not pregnant. Most especially, in female patients are taking this medication, because this medication can actually affect the fetus. And if you do find out that you're pregnant while taking this medication, you want to make sure that you stop that medication immediately and reach out to your doctor. With this medication, usually, like I said, you go through a training called iPledge training. If you are in the US, I'm not sure of other countries, but you have to actually go through a REMS. It's called risk evaluation mitigation strategy, the REMS program, and it's called iPledge, and it's basically you pledging to say that, you know, you're going to be using 2 types of birth control while you're on this medication. Basically saying that you're going to protect yourself from being pregnant. That way you're not causing, you know, any risk for your fetal problem. That way you're not causing any fetal risk if you do actually get pregnant while taking this medication, as this medication can have a terrible side effect on fetus if patients are taking this medication while pregnant. So like I said, if you feel like you're pregnant while taking this medication, make sure you stop it immediately. Or if you do miss your period and you feel like, you know, you did something, make sure that you stop it immediately and reach out to your doctor. That way they can let you know what the next steps of this medication are. Also, when it comes to using birth control, like I said, you want to use 2 kinds of birth control that you can trust 1 month before, you know, you start this medication, and during the medication, and for at least 1 month after you stop that medication. So you want to make sure that you're using that medication while also preventing yourself from being pregnant. That way you don't have any pregnancy complications when it comes to this medication. All right, I know that was a lot of information to digest. If you do need to take time, make sure you pause the video or write down all the things that I'm saying if you need to take note. But you can always refer back to this video if you need that information again. All right, if you are taking other medications and you would like more information on it or a video on it, make sure you go ahead and hit the like and subscribe button down below, and also comment the medication in the comment section. That way we can review it and provide a video tailoring to that medication. Also, if you need to consult with a pharmacist here at DemiRx Care, make sure you also go on our website, which is www.demyrxcare.com. Thank you for watching and stay blessed.